Penis. Your penis is far more than just a sexual organ. It's a barometer of your health. Men who begin to experience difficulties with erections often discover, years later, that the problem was not simply about performance, but a warning sign of something deeper. Studies show that within 7 years of developing erectile dysfunction, about 14% of men go on to have a heart attack. This is why erectile dysfunction is sometimes called the canary in the coal mine. An erection requires coordinated function from multiple systems: adequate blood flow, healthy blood vessels, balanced hormones, an intact nervous system, and a stable mental state. When one or more of these systems falters, erection quality declines. Instead of ignoring this sign, view it as an opportunity to protect your health. If you have difficulty maintaining strong erections, don't dismiss it as simply aging. Speak with your doctor. It may be the first sign of cardiovascular disease, diabetes, hormonal imbalance, or even psychological stress that requires attention. By listening to your penis, you are often protecting your heart, your brain, and your long-term vitality. 2. Don't try DIY remedies. The internet is full of false promises, herbal concoctions, creams, and strange techniques that supposedly enlarge the penis overnight or restore virility instantly. Let me be clear, there is no safe, at-home shortcut to alter the size or function of your penis. I have seen men injure themselves with these unproven methods, leaving scars, erectile dysfunction, or even permanent deformities. One example is jelqing, where men manually stretch their penis in an attempt to increase length. What actually happens is microscopic tearing of the tissue, which can accumulate into serious damage and scarring. Over time, these injuries may cause curvature or permanent erectile dysfunction. Another dangerous practice is the use of homemade constriction devices. I have treated patients who slid nuts, rings, or even plastic cutouts over their penis, only to find them stuck. In emergency rooms, we'd have had to use specialized saws to free them, sometimes after severe swelling and tissue injury. If you require a medical device, such as a constriction band for erectile dysfunction, purchase one designed for that purpose, not a makeshift alternative. Genuine medical tools are designed to be removed safely and are made of materials that protect the skin. DIY remedies are not only ineffective, but can be catastrophic. 3. Don't neglect hygiene. Hygiene is one of the simplest and most powerful ways to protect penile health. Washing the penis regularly with gentle soap and water prevents infections, inflammation, and foul odors. For uncircumcised men, it is especially important to retract the foreskin fully and clean underneath. Without this, secretions called smegma can build up, leading to balanitis, an infection and inflammation of the foreskin and glands. In rare but serious cases, men unable to retract their foreskin may not detect lesions or growths that signal penile cancer. While penile cancer is uncommon, the inability to inspect your own penis leaves you vulnerable to missing early warning signs. If you cannot retract your foreskin comfortably, see a doctor. Treatments may include topical creams, minor procedures, or circumcision, all of which can improve both hygiene and safety. At the same time, avoid excessive or harsh cleaning. Strongly scented soaps, scrubbing aggressively, or overwashing can irritate the delicate penile skin, causing rashes, microtears, or allergic reactions. The goal is not to sterilize your penis, but to keep it gently clean. Don't ignore pain or warning signs. Pain, sores, blood in the urine, or unusual discharge should never be ignored. These symptoms could indicate a range of issues, from sexually transmitted infections to urinary tract infections, kidney stones, or even cancer. Men often delay seeing a doctor out of embarrassment, fear, or the hope that the problem will resolve on its own. Unfortunately, delay often leads to worse outcomes. I have seen men present with advanced penile cancer because they ignored ulcers for months, sometimes years. By the time they seek help, surgery becomes extensive and life-altering. Early detection almost always means simpler, more effective treatment. If you ever notice persistent pain, swelling, sores, or blood, consult a healthcare professional. And if you feel judged by one doctor, find another. Your health and dignity matter more than pride or shame. Don't lose control during sex. Sex should be pleasurable, not dangerous. Yet one of the most severe penile injuries, penile fracture, occurs during vigorous sex when an erect penis bends sharply against the body or partner. The tearing sound, sharp pain, and swelling that follow are unmistakable. This is a true surgical emergency. Without prompt repair, about half of men will later suffer permanent erectile dysfunction or curvature. Staying in control during intimacy is crucial. Holding your partner's hips, guiding movement, and ensuring good lubrication all reduce the risk of accidents. Lubrication is not a luxury. It prevents friction, tearing, and painful mishaps. Remember, safe sex is not only about preventing infections or pregnancy. It's about protecting the very structure and function of your penis. 6. Don't overheat your testicles. Nature designed the testicles to hang outside the body because sperm require a slightly cooler temperature than normal body heat. Prolonged exposure to high temperatures, from hot tubs, steam rooms, or sitting with laptops directly on the lap, can impair sperm production and testosterone levels. If you are planning to have children or simply want to maintain optimal reproductive health, protect your testicles from overheating. Place laptops on a desk rather than your lap. Keep mobile phones in your back pocket instead of the front, and limit time in hot tubs. Occasional exposure is not harmful, but chronic heat can reduce fertility over time. Don't be harsh with masturbation. Masturbation is normal, healthy, and beneficial, but only when done safely. Some men develop what is called the death grip syndrome, where excessive pressure or overly aggressive techniques condition the penis to respond only to a level of stimulation that cannot be matched by a partner. This can create difficulties with arousal, erection, or orgasm during partnered sex. Instead, treat masturbation as an opportunity to explore pleasure in a way that mirrors real intimacy. Use lubrication, take your time, and avoid unnecessary force. Masturbation should be a positive and healthy experience, not a frantic or damaging one. By being gentle and mindful, you protect your sensitivity and preserve your sexual health for the long term. Don't smoke and care for your health. Few things damage penile health more than smoking. Tobacco use directly damages blood vessels, reducing blood flow to the penis and accelerating erectile dysfunction. Over time, smoking also increases the risk of bladder cancer, one of the most devastating and life-changing conditions we treat. But lifestyle extends beyond smoking. A poor diet, lack of exercise, excessive alcohol, and unmanaged stress all contribute to erectile difficulties. Strong erections are supported by strong circulation, balanced hormones, and good cardiovascular health. Regular aerobic exercise improves blood flow, while resistance training supports testosterone production. Together, these habits protect not only your penis, but your overall health and longevity. Think of every lifestyle choice as an investment in your sexual well-being. A healthy body means a healthier, more reliable penis. Don't be too hard on yourself. Many men respond to sexual difficulties with harsh self-criticism, which only makes the problem worse. Anxiety about performance creates a cycle. One failed erection leads to stress, which then leads to more failure, reinforcing the fear. Over time, this stress can become more damaging than the original problem. It is crucial to remember that occasional difficulties are normal. Every man, at some point, will experience a time when things don't go as planned. Instead of catastrophizing, practice self-compassion. Communicate openly with your partner. Reduce the pressure and understand that intimacy is about connection, not just performance. Treat yourself with kindness, and you will break the cycle of anxiety and dysfunction. Don't stop using it. There is truth to the phrase, use it or lose it. Erections, whether achieved during sexual activity or naturally at night, are essential for maintaining penile health. Nighttime erections, typically 3 to 5 per night, bring oxygenated blood to the penile tissue, keeping it elastic and functional. Without regular erections, scar tissue may form, leading to shortening or rigidity. If you stop engaging in sexual activity altogether, whether due to stress, low libido, or relationship challenges, your body may gradually adapt to a state of disuse. Libido may fall further, erections may diminish, and confidence may wane. Maintaining regular intimacy, whether with a partner or through healthy masturbation, supports both physical function and emotional connection. Your penis is not just an organ of pleasure, it is an indicator of your overall health, a partner in intimacy, and a vital part of your confidence and well-being. By respecting it, through proper care, safe choices, and healthy living, you safeguard not only your sexual function, but your quality of life. As men, too often we ignore or downplay problems with our sexual health out of embarrassment. But the truth is that timely attention can prevent long-term damage, preserve function, and even save your life. So take these 10 lessons seriously and treat your penis with the respect it deserves.